Hello, everyone. I'm Dr. Jason St. Pierre for Coopersurgical, part of the professional education and clinical support team. And we're going to talk about key factors in achieving optimal embryo transfer, um, including our VertiMed simulator that we're going to be. I'll be assisted by Lenny Laplatina, who will be demonstrating that. But we want to talk about embryo transfer. We've got so many great advances in the IVF field. We have, sperm selection techniques, PGT, improvements in embryo culture, embryo time lapse, but it all kind of comes down to this procedure. Okay, we can do all this work for 5-6 days, even longer than that with the stimulation, etc. And it comes down to this procedure on whether or not we're going to have success for the patient. So we've got plenty of guidelines out there. There's committee opinions, guidelines from our regulatory bodies giving us a set procedures on embryo transfer, but there's really not a lot still in the field of standardization. Okay, so this is just a survey, and this is really interesting because it shows that there's very little in the embryo transfer procedure that we have a consensus on. The one thing that's 100% was checking the catheter after embryo transfer. Hopefully all of us are doing that, making sure that that embryo did in fact stay inside the uterus. But another interesting one, catheter washing prior to loading, only 82%. But that's really an important technique. You want to flush the catheter with media, especially containing protein, and that protein is going to line that catheter and hopefully prevent sticking. So hopefully maybe we could see that a little higher. But the point here is this embryo transfer techniques are not standardized. So there's three factors of the embryo transfer procedure with grade A evidence that supports it. One of those is you don't need bed rest after embryo transfer. So hopefully no one's using bed rest. Also you need a soft catheter versus stiff. And then lastly, you need ultrasound guidance. And with ultrasound guidance, you need a catheter that you can see, that's has echogenicity. And of course, the Wallace SurePro has the patented echogenicity that you can see the entire catheter light up. Okay, so loading of the catheter, we see lots of different ways that catheters are loaded. Lenny's going to load his catheter his way today, so let's see if his falls up on this list. But when you do the analysis, you have some catheters have a solid column of media, some have air bubbles, etc. That doesn't seem to matter. What does matter is the volume of the actual media that's being injected into the uterus. So with that, we want probably in the 20 to 30 microliter range. Okay. Too little media, that embryo is not going to displace far enough away from the catheter, and you could actually, the embryo could adhere to any mucus or anything on the catheter when you draw it back. Too much media, you could really displace the embryo and potentially go all the way up into the tubes. Okay. Okay, transfer medium. Okay, there's lots of different techniques out there, and I don't want to start any arguments here today, but you can use either bicarbonate or heaps buffered media, both with very good success depending on your system. Some people use higher protein concentrations, 10, 20, even up to 50%. That doesn't seem to have an impact. Hyaluronan has been shown to improve, so there's a number of media out there with hyaluronan. And even GM-CSF, or granulocyte macrophage colony stimulating factor, cytokine, that does seem to improve success rates with FETs. But there's definitely more room for research here. Okay, the GM-CSF, we do have a media that is Sage One Step with GM-CSF, and that has been shown in this study to actually improve clinical pregnancy, ongoing, and live birth rates in FETs. So if you think about a vitrified embryo that's warmed, that's a lot of stress to the embryo. And this cytokine seems to help abate apoptosis and may even, in fact, allow that embryo to survive a little better and hopefully implant and get a pregnancy. So more research there. You can find out more about GM-CSF here. Okay. All right. So we are going to move into the demo phase here. Okay. So we're having some technical difficulties with the camera, but Lenny would, if he was doing a standard embryo transfer load, he was going to load a column of fluid, air, embryos, and then another air and a little media at the end, okay? But one of the things we wanted to show you is we have our Vertimed embryo transfer simulator, and this simulator, it can be taken on the road, so we could actually take it around the country, and if you guys have a need for training, we could do workshops, we could train fellows, and it's a really great tool. It can be used for initial trainings, but it can also be used to fine-tune, and we can actually show you some tips and techniques with the Wallace SurePro catheter to make sure that you're optimizing its use. So it has 5 different anatomies, so each of them have a varying level of difficulty, and we can change those out, and usually workshops can be, you know, anywhere from 30 minutes per person, like if you wanted to run through all the different anatomies and try, you know, there's one with the false passage, so it's pretty difficult. So Lenny's, and we've got here the embryo transfer catheter, which is the Wallace SurePro, and we're being assisted by another embryologist, Kevin, here, and it actually has an ultrasound, and you can either do like a live ultrasound, or you can just do, the machine will display the ultrasound for you if that's easier. And then it's going to run you through the different ASRM steps. Okay, you'll have to, of course, do the embryo transfer timeout. Then you will do inserting the speculum, rinsing the cervix. All those steps will be in order. And then you'll be asked to place the embryo transfer catheter, the outer cath, okay, which Lenny's doing now. Okay. All right, and then he's going to put the inner catheter in, and it's got a little syringe, and it'll actually measure the volume or the velocity of your injection, of how fast, because you want to do it slow and steady injection so that you're not really displacing those embryos too far away from the tip of the catheter. And it will even give you a target zone where exactly where you should be depositing the embryos, you know, 1.5 to 1 centimeter from the fundus. And then at the end, it will give you metrics. Great job, Lenny. Let's see how he did on the score. And it'll grade you on whether or not how well you performed. Did you put it in the proper place? Was your injection good? Did your inner catheter go or your outer catheter go too far into the uterus where it could damage? So Lenny got a perfect score. Excellent job, Lenny. All right. He's very well experienced, but this is such a cool tool, and we'd be happy if anyone is interested, please come talk to us, but we could bring this out to your facility and do a workshop. So thank you so much, everybody.